this video, I'm going to be doing an IM injection for Joe Milton. He's been complaining of agitation, so I'm going to give him a PRN of Haldol. So first thing I'm going to do is I'm going to just clean off my work area here, and I'm going to do some hand hygiene. I'm going to make sure that I have my MAR here and all my equipment. So I've got a needle here, 23 gauge and 1 inch. I know that Joe Milton is an average size male, so this is going to be an okay needle because you want to be between 23 to 25 gauges. Next, I have a syringe, a 3 milliliter syringe, and by looking at the chart here, or the MAR, sorry, it says that he'll be needing 2.5 milligrams it's 5 milligram per milliliter is the vial, but he is being asked to give 2.5 milligrams, so that would be half a milliliter. And so this will fit in the 3 milliliter. That's what I was trying to say. All right, and then I got my swab here, and I'm gonna make sure that I got my Haldol. I'm gonna look for that here. Alrighty, so I'm gonna do my first check. I'm gonna make sure that it's for Joe Milton. It says Joe Milton. I'm gonna make sure it's the right medication. It's Haldol, and that it's the right dose. So it's a 5 milligram vial, 5 milligrams, but I know that I'm only gonna give him 2.5 milligrams, which will be half a milliliter. So the next thing I'm gonna do is I'm just gonna clean off the top of this. Here we are. And I'm just gonna set all my stuff up. So just maintaining sterility as much as possible. I'm gonna open my containers. Unfortunately, they're already open. Not my containers, my syringe and needle. And I'm just gonna put them together, again, maintaining sterility as much as possible. All right, I'm going to just work the plunger a bit just to make sure it's not sticky or anything and that's working okay. And before I draw up any medication, I'm gonna do my second check. That will be also involving the 7 rights of medication. So starting off, I'm gonna make sure that it's the right patient. So it's Joe Milton. It's the right medication. It's Haldol. It's the right dose. I will check that again. It's gonna be half a milliliter, but I'm gonna check it again on my third one as well. So he's getting half a milliliter. I know that, I've already done the math. The right reason, so like I said, it's for his agitation. The right time, it's a PRN, so I'm gonna be giving it now. I'm gonna make sure that he hasn't had it. It says between every 4 to 8 hours. He hasn't had it in a couple days, so I know that it's okay to give it to him. And then the right route, so I know it's an IM, and then the right documentation, which I will be doing later. All right, so then the next thing I'm gonna do is I'm gonna draw up the half a milliliter here with air. Take my needle off, or my cap off, sorry. And I'm just gonna put the air in first, and then I'm going to flip it up, and I'm going to draw up my medication. All right, so there's no bubbles or anything like that, so I'm gonna make sure. So if you wanna see that I got the right dose, so there's a little bubble there, but I think it's okay for the video. So it's a half a milliliter there. I'm going to recap the needle without, safely, just like this, swooping it in there so I don't stab myself. And then before I go to the patient's room, I'm going to put the medication away, and I'm going to do my third check. So again, gonna make sure that it's for the right patient, so it's for Joe Milton, it's the right medication, it's Haldol, and that it's the right dose. And like I said before, I'm gonna check to make sure now that it's the right dose, half a milliliter, and yeah, he needs 2.5 milligrams, so it makes sense. Okay, so then I'll put my medication away, and I'm going to go bring my MAR and this, and there's already a swab by the bed, I already know that. So we'll go this way. Before I enter the room, I am going to do some hand hygiene. Hi, my name's Cora. I'm going to be your nurse today. I'm going to give you your IM medication because you said you were, or injection, sorry, because you said you're feeling a little agitated. Can you tell me your name?
Joe Milton.
Okay, and your date of birth?
July 13th, 1963.
Perfect. I'm just going to check your wristband just to make sure that everything's good. Perfect. All right, so I'm going to give you your injection in your arm here. Is that okay? I'm going to give it in the deltoid because it's not invasive, or less invasive, and it's a small amount of medication. Do you mind just helping me roll your sleeve up there?
Sure.
Perfect. So I'm going to put gloves on just because I'm touching the patient, just it makes him feel comfortable, or just to stay as clean as possible as well. I'm going to put my gloves on. Okay. And then I'm just gonna already open this swab just to make it easier for myself. All right, so the first thing I'm gonna do is just landmark, all right? I'm gonna find the acromion process on your shoulder here, and I'm gonna go 3 finger widths down, and, ooh, there's a little cat here, and I'm going to make a V, and I know that the shot is gonna be right in the middle of that V. So I'm gonna hold that there, and I'm just gonna clean the area. Ooh. A little hard, got only one hand. Sorry.
It's okay.
There we go. Okay. I'm going to clean the area here. Perfect. And I'm just going to use this as a landmark while I grab the needle. So I'm just going to hold it there. I know I'm going to give the shot right there. All right. So I'm just going to keep the needle, I'm going to keep the cap on for this. So I can take this off now because I know it's going to be right there. I'm just going to spread Z-Track a bit here and spread the skin. And then at a dart-like motion at a 90-degree angle, I'm going to go into the skin, stabilize the needle. I'm going to aspirate a bit just to make sure that there's no blood and we're all good to go. So I'm just going to draw the medication in 2. You doing okay?
Yeah.
Okay, perfect. And then I'm just going to take it out. You doing okay?
Yeah.
Okay. Perfect. It's not bleeding anything. If it was, I'd give you a Band-Aid. All right, so I'm gonna displace this into my sharps container here. And I'm just gonna clean all of my stuff up. I'm gonna do some hand hygiene before I leave the room. Take my MAR with me, and I'm just going to document that I gave the medication, at what time, and so on.